In this lecture, I would like to explain you what is the matrix. But first I would like to introduce myself very quickly. My name is Sandro Venazzoni. I'm originally a mechanical engineer. I studied here in Zurich at the Swiss Federal Institute of Technology, and directly after my studies I moved to Straumann. I started there in the development and product management for instruments and implants, but very soon I realized that actually the digitalization is the most exciting topic for me in implant dentistry. So I moved to the digital unit within Straumann, where I was the head of product management for the digital technologies. After 6.5 years, I left Straumann, and since then, since about 10 years, I've been the Chief Technology Officer of TRI, and every single day I've been thinking about how to improve digital implant dentistry. TRI is an implant provider from Switzerland. Our philosophy is to provide premium Swiss quality. That is really the foundation for everything we do, but we really try very hard to develop a very simple and intelligent implant system, and our key is really to understand the digital workflow and to provide the best implant system for the digital technologies that is integrated into the digital technology. So today we are going to talk about our newest implant line, the TRI Matrix implant that can be restored with no abutment, no cement, no limits. So this is really what I would like to explain you today. What is the Matrix, the world's first dental implant without an abutment, made for the digital workflow. We've had this product now on the market for almost 2.5 years. We have 6 world first features that I will look to show you that make this possible to work in a full digital way without abutment. We have 8 unique patents built around this technology. It's CE approved in Europe, FDA approved in the US, and we are the winner of the Red Dot Design Award. So this is how it works. We have an implant like you know it, but then we don't have an abutment in between. The crown the bridge is screwed directly on top of the implant. As simple as that. So here you see the crown that goes directly to the implant. So what is the background of this invention, of this development, the Matrix technology? We have realized in the last 10 to 15 years that the world in dentistry has changed. Today we have a lot of new technologies such intraoral scanners, milling machines, printers, software, new kind of materials, but to be honest, the implants and especially the connections, they haven't changed for 30 to 40 years. Today we still have the old connection like the hexagon connection, the octagon connection. All these connections are great. They have been developed 30 years ago to connect the titanium abutment to the titanium implant. But they're definitely not suitable anymore for the full digital workflow, because when these connections were developed 30 years ago, nobody knew about any digital technologies. So there is really a mismatch, how we call it, between the old world, the implants that you know, and the new world, the digital technologies that help us greatly to build a restoration on top of the implants. So that's why we have to use abutments or titanium bonding bases today to connect this old world and the new world, and they offer great disadvantages. Limited design flexibility, aesthetic challenges because a great titanium abutment sticks out of the implant, a risk for inflammation, and a high cost due to the large number of components. Today I would like to show you the unique benefits of working with the Matrix solution, of working fully digital without abutment. I would like to show you how this solution is going to help you to provide an immediate treatment to the patient. The patient will leave your office with a crown and not just with an implant. How to make your implant restorations much simpler, and why we believe the Matrix solution is unique in biology. Let's start with the immediacy. This is a case, a patient treated by Professor Ronald Jung at the University in Zurich. This was now at 3 p.m. in the afternoon, a standard implant procedure, drilling, then inserting the Matrix implant into the bone and then making a scan just 30 minutes after implant placement. A very straightforward procedure, how you do it every single day. But then it's different. Based on the scan, we make a design for the provisional crown, we mill it in just 20 minutes, and this is the crown at 4:15. So just a bit more than an hour after implant placement. And this is 90 minutes after implant placement. The patient goes home with a beautifully manufactured crown, and there is no manual work. There is no the dental technician involved who does any cementation using an abutment. It's milling the crown and inserting into the patient. So Professor Ronald Jung was extremely happy. He said, this is what the patient wants. The patient wants to go home with a crown, but if you do it in a manual process, it's just too difficult, too annoying to do it. Here is a fully digital workflow to deliver this beautiful provisional crown at the same day. So he really said, this is going to change the way how we, at the University in Zurich, we restore patients. What's also quite interesting, so the example we have just seen was based on milling technology. We believe to provide an immediate provisional, the 3D printing is also very, very attractive. Especially for the 3D printing, we have developed the Scan and Smile in 1 hour solution. So this is how it works, and the key to this solution is a design service that we offer. So you're a dentist, you don't have a dental technician in your office, and you still want to deliver an immediate crown just 60 minutes after implant placement to your patients. So how does it work? You place the implant like we have seen it. You make an intraoral scan, same with a scan body like you do it every single day. But then here is the key about the design service. You just upload your intraoral scan to our design service, and in maximum 20 minutes you receive a design file of a provisional crown or bridge that is sent directly to your local 3D printer where the crown or bridge is printed. You take it out and you insert it into the patient's mouth. So this is a beautiful way to immediately restore your patients with provisional crown and bridge in your clinic without the need of your local dental technician. But then, of course, for the final restoration, we need a zirconia crown, we need a dental technician. Here is an example of the case before. We don't have to do a new design, we just mill the same crown, not in PMMA, but in final zirconia. 3 months later, this is how we insert it, and we see here the result after 2 years, a beautiful zirconia crown in place with amazing bone levels. On the matrix implant. This crown is now a final crown in zirconia. So this is the benefit of providing immediate crowns and bridges to your patients. Second benefit of the matrix is the simplicity. We want to heavily simplify prosthetics on dental implants. This is an interesting comparison. On the right-hand side, you can see our conventional implant system with multi-unit abutments. On the left-hand side, you can see the matrix solution. So, conventionally, we use multi-unit abutments in different angulations. There are screw and we use some tie bases that are cemented into the bridge and another set of screw to fixate the bridge. With the matrix, you use the implants, the bridge, and just 2 screws to fixate it. So, significantly less components, less interfaces, less communication, less connections with cement, and less potential mistakes that can happen. This is our product catalog. It has 2 pages. This is all the prosthetic components you need to restore all your matrix implants with all the materials, all the indications. Compare it to the product catalog that you're using today with all the abutments, all the healing colors in all the angulation, all the different types of abutment. So it's just 2 pages, and that's all you need to restore all your patients with all materials, because we don't have any limitations. No limitations in angulations, indications, and materials. On the matrix implant, you can use metals, you can have titanium bars or bridges. Of course, we can have zirconia directly made to the matrix, or also PMMA for provisionals. We can cover all the indications from single crowns to full arches, and it's a very flexible system. All the angulation, you can compensate plus minus 50 degrees between the implant and still screw retain a bridge that's essential for the all-on-4 treatments where you have big angulation in the posterior implants, or you can also angulate the screw channel just to avoid the screw coming out in the aesthetic aspect. So this is an example. We have seen a single crown before. This is an example of a full arch. You see the heavy angulation of the implant. After 2 years, this zirconia final restoration still beautifully in place with amazing bone level and amazing tissue level. So this is the aspect of simplicity. Implant prosthetics is getting very simple. No more selection of abutments, no more combination between many parts that can lead to problems or misunderstanding. So just a crown or a bridge that is directly screwed to the implant. Third unique thing about the matrix is the biology. The first aspect to the biology is the matrix implant design. So we have a multi-level implant design. It's not a bone level implant, it's not a tissue level, it's a multi-level implant. We have included a 1.8 millimeter pink anodized implant neck with a reverse taper with beautiful concave design with a pink color, so there is less problems of a gray discoloration of the soft tissue. So based on the anatomical situation, you can place this implant as a tissue level implant, like in the molar area with thick soft tissue, or you can place it as a bone level implant when the soft tissue is thin, or also in the aesthetic reason. So it's really a safety zone to have this 1.8 millimeter pink anodized area. So the rough surface is always a little bit below the bone, and we all know that a rough surface is great for osseointegration, but it's also a great risk for periimplantitis. But then the most unique about the biology is that the matrix solution is 100% cement-free. So this is a beautiful case from Dr. Marco Zeltner in Switzerland. So you can see there is the implant beautifully embedded in the bone with this pink anodized neck, the concave profile, and you can even see here how beautifully the bone attaches here to the slim neck of the implant. And then we don't have any abutment on top of it. No tie base, no gaps, no sharp edges. It's a beautiful zirconia crown, or even call it a zirconia tooth, that is directly screwed on top of the implant. So there's nothing better for the biology. It's the slim pink titanium with a transition to high polished zirconia. So that's the best you can get. Anodized titanium and high polished zirconia. No cement gap, no sharp edges, no connection. So this is really, the best is always to keep your natural teeth, of course, but this is the closest we can get to biology in dental implantology. 100% cement free. So that's really the unique about the TRI matrix, what you're going to learn, how to treat the patients with this matrix solution in this certification program, to provide an immediate crown to the patient, how to make your life, but also the life of your team, much simpler when it comes to implant prosthetics, and how to benefit from the biological advantages of this concept. The product has been on the market now for 2.5 years. We have sold 10,000 of matrix implants. We have collected a lot of scientific evidence around this solution. So we have in vitro studies from Zurich University with Professor Jung, from Munich University with Professor Edelhoff, and all these studies show that there is no problems between this connection of titanium and zirconia, and no problems in the mechanical stability. We have beautiful case documentation. We have 2-year follow-ups in all the indications. If you're interested, go to our website and download the casebook with cases in all the indications with at least 2-year clinical follow-up. We have several clinical studies running around the globe, in Zurich, in Sao Paulo, in Groningen, and in Holland. A lot of implants have been placed and restored. We don't have any adverse events in these studies yet. And we also have our first post-market clinical follow-up study. After 2.5 years now, 2,334 matrix implants have been documented with an amazing success rate of 99.7%. Everything can be found also on our website about the clinical evidence. How is this possible? People ask us. How can we work without abutment while all the other systems need abutments between the implant and the crown? So it's taken us several years to develop these 6 world's first technologies to make this possible, like the Mill-Fit technology. How can the lab make this perfectly precise connection on the local milling machine? So this is one of the key aspects to these technologies, where also a lot of patents are built around, or the power-based technology that we can connect zirconia directly to the titanium without the risk of any fracture in the connection. So in this certification program, you're going to learn all about the technical aspects of this matrix solution, how to do the CAD design on the matrix, how to do the milling for the labs, but for the dentists, how to place the implant surgically, and then how to restore the matrix implant. So this is really a comprehensive certification program for dentists and dental labs. When you complete the certification program, you will get a certificate for placing matrix implants, restoring them, or for the labs to do the CAD design or the manufacturing of the crowns. So that's my quick introduction from a technical side. What is the matrix? Thank you very much for taking the time. Do not forget, if you have any questions, to contact us at any time at matrix@tri-implants.swiss.